So now I invite the first speaker, Dr. Mallika, Professor of Ophthalmology in Trichur Medical College, to give the talk on Vision and Brain, Understanding CVI in Children.
Good morning, one and all. Thank you, Dr. Geeta, for giving me this opportunity. My topic is Vision and Brain, Understanding CVA in Children. By definition, CVA is the verifiable visual dysfunction which cannot be attributed to disorders of the anterior visual pathways or any potentially co-occurring ocular impairment. Why the CVA is becoming important in India? Because it is emerging as one of the commonest causes for visual impairment among children in our country, maybe because of with improved management and survival of preterm babies, children affected by brain injury due to perinatal insult, metabolic disorders and trauma. And there is the need for multidisciplinary approach for management in specialized, and it is very specialized and it is very challenging. If you check the epidemiology, the incidence is 36 per 1 lakh in late 1980, but it is 161 in 2003. So if you check the Indian scenario, this is also not much different. And the Indian study also shows that the prevalence of CVA is similar, and also it is very similar in children belonging to the rural population and the urban population. If you check the Western data and the Indian data, the main causes for visual impairment in children is almost the same. Now, we see how does the brain see. We all know the visual pathway, the stimulus starting from the object to the eye, and how does it reaches the retina, and through the visual pathway to optic nerve and the optic radiations to the laterogeniculate body and then to the occipital cortex. And what happens when the image reaches the brain? That is important. There are three important stations where it is conveyed and it's interpreted. One is the station 1, that is the occipital lobe, and the second station is the posterior parietal lobe, and third station is the temporal lobe. So this is the information passes from the occipital cortex, then and in the occipital cortex, it is interpreted visual acuity, the color vision, the field, etc. The information also passes to the next area, that is the middle temporal lobe, which is the area of visual attention. And then it also passes to the temporal lobe. This is considered to be the library of the visual system, where the images of the different objects and persons which is being stored. So whatever objects we see, and we will match these objects with the images stored there, then interpret, oh, this is that particular person, this is that particular object. All these are taking place in a very slow process and at a conscious level. Then information then passes to the posterior parietal lobe. This is the area of visual attention. Suppose we want to see particular object in the midst of so many objects, this area comes into play. This area acts in relation with the other parts of the brain, like that is the frontal brain, and it has association with the motor area, sensory area. Suppose we want to take an object from the table. In the table there are so many objects are situated. Suppose we want to take a particular object, and we should think of it. What should be the distance I should move, and what is the acceleration I should take, and want to take particular object. That is decided by this area. So that is the importance of this area. And there are two streams. One is the dorsal stream, that is otherwise called Ver stream, that is in concern with the location, movement and spatial orientation of visual pathway. And the other is the ventral stream, that is otherwise called Vod stream, that is concerned with the color, texture, pictorial detail and the visual memory. So what are the causes of the CVA? Major cause is the hypoxic ischemic injury in the perinatal period. If it happens in the full-term neonates, that will result in watershed infarction in the parieto-occipital region and the parasagittal area. If it is in the preterm neonates, that will result in periventricular leukomalacia. Other mechanisms are oxidative and inflammatory damages that will lead on to death of immature oligodendrocytes. These are some of the etiological factors. One is the this meningitis, especially due to herpes simplex and bacterial infections, and head trauma that will lead on to posterior cerebral ischemia and subdural hematoma. All can lead on to venous sinus thrombosis, thrombophlebitis, hydrocephalus, hypoxic ischemic insult to the watershed areas. And there are certain congenital malformations like Chiari malformation, encephalocele, meningoencephalocele, and hydrocephalus, posencephalic cyst, and hydrancephaly, Dandy-Walker malformation. All these are supposed to be the causes. CVI in late child are due to melas ornithine transamelase deficiency, Fabry's disease, Leigh syndrome, X-linked adrenoleukodystrophy, respiratory arrest, head injury, complications of cardiac surgery and cardiac arrest, focal infections, etc. How do these children present? They can have mild visual loss and to the total or near total blindness. So, ocular findings are refractive error. They can have hypermetropy is more common. They can have strabismus, exodeviation is more common, and they can have nystagmus, and that implies coexistent anterior visual pathway involvement or onset of visual loss before the age of 2 years. And tonic down gaze and horizontal gaze palsy, all these are very commonly seen. And the other common findings are optic disc hypoplasia and pseudoglocomatous optic atrophy like findings. To conclude, the eyes just see, but the brain visualizes. The knowledge of complex visual processing in the brain helps better understanding of CVI. So every ophthalmologist should have a basic knowledge and aware of CVI. Thank you so much.
Thank you, Dr. Mallika, for the lucid presentation.